Okay, start பண்ணலாம் bro. Good evening, everyone. I'm Akash from IMA-MSN Tamil Nadu State Branch, and it is my privilege to welcome you all to today's session on behalf of RIC Subcommittee of IMA-MSN Tamil Nadu State Branch. I extend a very warm welcome to all our esteemed speakers, respected mentors, and enthusiastic participants who have joined us today for RIC 26 ICMR STS series, a one-on-one research mentorship program designed to simplify and strengthen the research journey of medical students. At the outset, I would like to respectfully acknowledge the constant guidance and encouragement of the patrons of IMA Tamil Nadu State Branch, Dr. B. Sridharan Sir, State President, IMA TNSB, Dr. P. Sengutavan Sir, Past President, IMA TNSB, Dr. A.K. Ravikumar Sir, President-elect 2026, IMA TNSB, Dr. N.R. Tyagarajan Sir, President-elect 2027, IMA TNSB, Dr. M. Thiraviyam Mohan Sir, State General Secretary, IMA TNSB, Dr. D. Solomon Jaya Sir, State Finance Minister Secretary, IMA TNSB. I would like to convey my sincere regards to our state leadership team, Dr. R. Annamalai Sir, Chairman, IMA-MSN TNSB, Dr. S. Jamuna Rani Ma'am, Co-Convener, IMA-MSN Tamil Nadu State Branch, Dr. V.S. Hariharan Sir, Chairman, IMA-JDN TNSB, Dr. Kannan Rajendran Sir, Convener, IMA-MSN Subcommittee, and a special appreciation to the state team members who continuously support the initiatives of the Medical Students Network. Dr. Arunagiri Sir, Convener, IMA-MSN TNSB, Dr. Ajay Karthik Sir, General Secretary, IMA-MSN TNSB, Dr. Bala Hariharan Sir, Co-Convener, IMA-MSN TNSB, Dr. Hariram Sir, co-convener, IMA-MSN TNSB. Research is often seen as something difficult, complicated, or reserved only for the experienced academicians. But in reality, every great discovery begins with a simple question and a courage to explore it. Today's session is designed to help medical students understand the research is not as difficult or distant as it may seem. From choosing the right topic and framing a research question to building methodology and writing proposals, our speakers will share practical guidance, common mistakes to avoid, and valuable insights to help students confidently begin their research journey, including opportunities like ICMR STS program. We are truly delighted to have passionate student researchers from various institutions across the country joining us today to share their experiences and perspectives. Without further delay, let us begin today's session and move one step closer towards building a stronger culture of student research and innovation. Thank you. And I would like to introduce today's moderator, Manoranjani Venkateshan, who is RIC subcommittee head. Over to you, Manoranjani. And I would like to invite today's speakers. Speaker number one, Varshita. She'll be talking upon the topic from curiosity to clinics, spotting the right research question. Over to you, Varshita.
Okay, Varshita, you can just share your screen and unmute yourself. So before that, good evening, everyone. I'm Manoranjani Venkateshan, RIT Subcommittee Head of IMA-MSN Tamil Nadu State Branch Team. So I welcome everyone who joined this panel discussion. I hope this panel discussion will help you out in clarifying everything. So starting out in today's session, I know how many of you research often feels overwhelming, right? It is not just because we lack ideas, it's simply just we doesn't know where to start and end. So we are going to spot everything from clinical questions to writing a proper proposal that can get approved and hopefully. So yes, everything will be clean and clearly explained in today's panel discussion. Over to you, Varshita.
Thank
Varshita
you,
will
Manoj.
be, yeah, go on. Varshita will be starting with from curiosity to clinics, spotting the right research question. Yes, please.
Thank you. So, good evening to one and all present here. I'm Varshita. Uh, I'm actually glad to see such a good turnout today because honestly, very encouraging to see students who are interested in research and scientific. Yeah, firstly, I'd like to thank the RIC subcommittee for giving me this opportunity and inviting me to speak with them. To tell about myself, I'm an ICMR ST scholar of the year 2025, and I have done a few research projects. All right, so moving on to today's topic, we're going to talk about is finding your research question. Many students they tend to avoid research because they think it requires advanced statistics or expensive lab equipment or extraordinary ideas. But undergraduate research is mainly about two things. One is structured observation and asking the right question. So before we talk about proposals or the ICMR STS selection part, I think the first important question should be this. What actually makes a clinical problem worth researching? Because not every interesting thing is a research question. So when do we tell or when do we say a problem is worth researching? We would say there are three things for it. One, when it affects a definable group of people, not just one patient. The answer is not clearly known in terms of local data. And solving this particular problem, it can either change or improve the practice, protocol, or policy. To give an example, I've given it here. Let's say I notice many diabetic patients in OPD are non-compliant. Is this a research question? Yes. But if and only if we do not know why, or if the local reasons they differ from the published data. Research is, to put it in simple words, is just structured curiosity. If I had to take the same example, I'd say let's say I see many diabetic patients who are skipping medication. This statement, this is an observation, but this becomes a research when you ask following questions of how common it is, why does it happen, is it due to a cost, education, side effects, or any myths associated with it. And as I said, since research begins with curiosity, not conclusion. For example, instead of saying for an example, let's say instead of saying poor patients are not compliant because they not care, a research mindset would rephrase this as what factors are associated with the poor compliance. So this is just a basic pep talk before we get into the actual stuff, which is what ICMR STS expect. As you all know, STS is designed for low resource, short duration work, and it mainly wants these things. It needs a clear question, feasible methodology, something which has local relevance, whether it's practically you can complete it practically within the limited time, whether you could do it within one institution. You do not need any advanced lab infrastructure, and you are the primary data collector. There's a very common misconception that you might need a groundbreaking or a fancy topic. The truth is, you just need a well framed and a locally relevant question to increase your chances of getting selected. So, what are the types of studies that usually get selected here? Here, one of the most common one is knowledge, attitude, practice studies, KP studies, which are among the most commonly accepted ones. Apart from which, you have your cross-section studies, which includes either survey-based or questionnaire-based study, and even prevalence studies are valid when it comes to STS perspective. So how are these proposals selected? So when an ICMR reviewer, when they open a proposal, they just silently ask these questions. Is the question clear? Is the research question clear? Can the student complete it? Is the methodology logical? Is it ethical? They produce meaningful local data. So I have listed out here in 5 points. Firstly is the feasibility. Whether can the student, as in the UG student, can realistically complete it within the available time, resources, and the sample size. Secondly is the clarity of objectives. Are the objectives specific, measurable, and answerable? This is very, very important because clear objectives equal strong proposal. If your objective cannot be measured, then it cannot be researched. Third is the methodology. Whether is your study design appropriate, are the inclusion and the exclusion criteria for your study population clear, is your plan overall logical. The fourth step, it's a non-negotiable part, which is ethics. That includes your informed consent, confidentiality, approval from an ethics committee. And finally, the local relevance. If the study generate data that is useful for our population, local population or your local setting. And one more very important thing, selection is not only about the topic because two or more students they might have the same idea. So the better written proposal with clearer methodology, that's the one which often gets selected. And of course, no study is perfect. So it's always important to acknowledge your limitation because if you acknowledge it, it actually strengthens your research rather than weakening. So how do you know whether your research is novel? So what does novel mean? I mean, to put it in simple words, it does not mean like nobody in this world has ever done. A novel can mean a different population, it can mean different location, it can mean different time period, different outcome. So I've listed here in 3 steps where you can check whether your idea is novel based on the simple definition which I had. Firstly is using PubMed or Google Scholar, where you use certain keywords from your research idea along with your study population and I mean which city or which state do you belong to. And then you check whether Indian data exists. This is very, very important because there are certain studies where there's global relevance, but there is like zero data when it comes to Indian. Because if the data does not exist, that becomes a research gap, and this research gap it becomes a scope for your research topic. And if the data exists, but it's like more than 10 years old, that is also a valuable gap. And another important thing is like when it comes to choosing topics, locally unanswered questions are the ones which are globally valuable. Sometimes even when you do replication studies with a new population or a time period are acceptable for in STML, STS point of view. Okay, so yeah, and then okay, so as I said earlier, research it does not begin with any articles or any journal. It begins when a clinician notices something and they repeatedly ask the question, why? Because as medical students, we are always surrounded by unanswered questions like every single day, like be it in our OPDs, our hospital wards, classrooms, our community. The goal is not to discover something revolutionary overnight. The goal is to learn how to observe carefully, think critically, and also ask meaningful questions. Because the future of medicine it does not only depend on treating the diseases well, it also depends on asking better questions. Research questions are everywhere
Sorry
around
to
us.
disturb, but the slide is not visible.
Yeah, I'm actually done with it. 1 second. I just like, cancel the screen share. Just give me a moment.
Yes, Varshita, you can go on.
Yeah, so yeah, as I said earlier, so research questions they are everywhere around us. So the real skill here lies in recognizing them, finding them, and framing it properly. And that brings to the next step on how do we convert an idea into a well-structured research proposal, which should be covered by the other speakers. So that's all from my side. Thank you very much.
Okay. Thank you so much, Varshita, for giving a very good introductory. It's a very important topic on how to figure out a research question. I have a few questions for you, which I got from the students who had joined the group ICMR STS group. So I'll just move on with the first question. What makes a research, question stronger in general?
So there's one category which they simply say it's known as the final criteria. To put it in simple words, it stands for feasible, interesting, novel, ethical, and relevant. So it's just an acronym. So these five points is what makes a research question strong.
Great, great. Okay. I have the second question. How do we avoid, turning every clinical observation, all kinds of things we see, into an unnecessary research? And how do we, come into a proper research question?
First thing, curiosity. Like I said earlier, since research is a structured curiosity, curiosity it starts the research, but irrelevant what justifies. So a clinical observation it only becomes something worth researching only if it's like recurring, if it lacks clear existing evidence, it affects a defining population, and answering that question, it could influence the practice and understanding when it comes to medicine.
Okay, great, great. Thank you so much. So next we'll move on to the second speaker. Yes, Shravan, Mr. Shravan.
Hello everyone.
No, that's
Am
a
I
question,
audible?
I guess. Manu,
Yes, Akash sir, yes.
there is a question in the chat box. Can you read that?
Yes, yes, sure. Okay. Thank you, Iftar, for your question. All the questions we'll keep at the end of the audience round once the all five speakers are done. Yes, we'll hold on to your question. Your question will be answered at the end of the session under audience round. Yeah. We can start with the second speaker. So, yes, now that we understood how a good research idea, to identify them, our next challenge is that is avoiding the mistakes that we consider, right? So here in our second speaker, Mr. Shravan will have a topic on crash and learn, common topic mistakes that are done in the research and how you dodge them. So yes, over to you, Mr. Shravan.
Hello everyone, I am Shravan. I am a third year MBBS student at GMC Akola and also an ICMR STS Scholar 25. Today I will be speaking on the topic of like how to select topic for your ICMR STS proposal and what things you should keep in mind while doing that. Okay, so actually the previous speaker has made my work like quite easier. So let's take a quick recap. So whenever it comes to topic selection, so this is the very first question that many students have. Like, how do we start? Like, how to get our topic? So, what is the process for that? And also, I believe, in my opinion, this is like one of the most important aspect of your ICMR STS proposal because this will be something. The title of your proposal. This will be something that will be come into the eyes of your evaluator for the first time. Okay, so let's understand how to do that. Okay, so topic selection. So if I want to like break down into it like stepwise into very simple 5 steps, what I would like to suggest is like first of all identify your own interest. Like what are you really interested in? Whatever your interest lies in, whether it is a disease or whether it is a community or whether it is a health area, anything that ignites your curiosity engine. So first you have to understand where your interest lies. First choose the subject, then choose the topic in it, like the domain in that. Okay. After you have done that, then try to find local problems that are present related to that topic, related to your interest. Okay. So one simple way of doing that is you can access to like public health data like NFHS and other stuff. So by that you can get to know like whatever problems are there present in your locality or what kind of patients come to your OPD in your hospital or medical college. So after understanding the local problem, then only you will be able to proceed further. So after you have done this, then you have to do a literature search, okay, on that specific topic, okay, and you have to know a bit more about it. You can do a brief like a brief and deep literature review on that, which will help further deepen your understanding on the topic. Then you can find whatever parameters you want to assess, whatever basic raw idea is there in your mind that I want to do a study comparing these two parameters, or I want to assess this and this in this kind of population, target population, let's say hypertensive people or diabetic people, diabetic population. So, yeah, the very the most important thing is literature search, as mentioned earlier by the previous speaker also. So, after doing the literature search, you would get to know what existing data is there, what evidence is there already present. Okay. So, and after seeing that, you will come to know whether, see, if the such kind of studies have been conducted in your area or not. Even if such types of studies have been conducted in your area, go and once read those studies. Read thoroughly the outcome part of it. What were the findings in those studies? What were the limitations of those studies? Okay. Even by reading that part, you can get your idea. Like, let's say, if the study was just conducted in an urban population. So what you can do is like you can do a study which can be in a rural setting or which can be a comparator like urban versus rural population. Okay. So the previous studies lead the foundation, like give you the direction for your topic. Okay. After that, okay. So this is how you get to your topic selection. Okay. So now moving ahead, the next thing is like topics from which topics get selected, right? So whenever you have selected your topic, you have to ask some questions to your topic. Okay. So ask to yourself, if this study is conducted and whatever outcome that is presented after completion of the study, does it help the patients or the community? Does it help you answer any unresolved question? And the very important thing, is it methodologically sound and clear? Okay, so these are some of the important questions that you need to ask. If your topic fits in them, then only it is a good topic to go with. Okay. Next is, now the thing is, there are certain like topic domains, okay, which are like you can say preferred by the ICMR if you conduct research studies in these areas. Okay, so these have been declared by the ICMR as a national health research priority topics, and they can be like broadly classified into 5 categories. Okay, first one being the communicable diseases, in which you can see like tuberculosis, vector-borne diseases. Then there is AMR. Then the second thing is non-communicable diseases. As we know, NCDs are growing rapidly. And then after that, RCH, that is a reproductive child health and nutrition. Then in other topic comes like the acute emergency care and oral health. And recently ICMR has also included primary healthcare into that. So these are some of the topic domains which have like they give preference to them if any research is conducted in these topic domains. But that doesn't mean that if your topic is out of this domain, then it will not be selected. If it is as good as the other topics, it will have the equal chance. Okay, so moving ahead. Now, many students, while choosing their topic, so you all guys also may have like you shortlist some 5 to 10 topics, and then you think like, what should I prefer more? Should I focus more on the novelty aspect or the feasibility aspect? What is more important for the ICMR STS study? Okay, so in my observation, whatever I have observed from like my own proposal or proposal like STS studies of other my fellow colleagues, so it has been observed that if you have to actually maintain a balance for that. Okay, so I will give you like a 3 case scenarios. So we have a study proposal A, study proposal B, and study proposal C. In study proposal A, it is a very novel topic, okay, but the feasibility of the study is somewhat on a lower scale in terms of feasibility, or that is not much possible for you to conduct in the given time frame of 2 months. You have to like keep it in mind that the data collection for your study is like the duration for that is only 2 months. Okay, so it should look like that. If you conduct this study, okay, it should be possible for you to collect this data within 2 months. If the evaluator thinks like, if doesn't matter how good your proposal is, but if it feels like a student cannot completes its like the data collection part, or this study cannot be completed in the given timeline, then the project will not be selected. Okay, so that was the study A. Then there's a study B. Okay, study B is a very simple study. It's very feasible, easy to conduct. Let's say some form of questionnaire study or anything. You can do survey based study or anything. So, but it has been like conducted many times in your area also, and you are just replicating a study that has been done, and there is nothing new in that. Whatever data you will be gathering, that the data is already available to the public, okay, in the health records. Okay, so that also does not form a very good proposal for your ICMR STS application. So what's the better approach to this is like you do a study, okay, you choose a topic such that it is feasible, okay, but also you have to add a pinch of novelty in that, okay. So when I already told you that whenever you are like, even if you are going through studies that have already been done in your area, go to the limitations part of those studies. Okay. See in which settings they have been done, see what limitations were of those studies, what are where the outcomes of those studies, and then try to think what you can do differently such that it will produce data, okay, which is useful, benefiting, and also the study is feasible and easy to conduct, right? Coming to the next part. Okay, so lastly, I would like to say, if I want to summarize it in like one line, so I would say like a research project is as good as its ability to be completed effectively and ethically, especially by a student already burdened with the medical curriculum. That is the thing that the evaluator is gonna be keeping in mind. So in ICMR, generally the studies which have more feasibility are ethically correct, and also they have a robust methodology, okay. So these studies have a higher chance of selection. So yeah, so that was from my side.
Thank you so much, Shravan. It was a very good presentation from your side. Guys, whatever doubts you have, you can just keep it ready. At the end of the session, we'll clarify it. Shravan, I have few questions for you, which I previously got again from the students before. First is how to, select a topic and get an importance of that topic selection.
Yeah. So as I have mentioned in my presentation also, whenever you are selecting any topic, you have to like keep in mind like the all the things. Like it should be feasible, it should be ethically correct. Also the whatever methodology you will be choosing for it, it should be robust. And also it should align with like it should look, if I want to summarize it, I would also like again say that a topic, it should look, whenever the evaluator goes through your proposal, it should feel like this is something that can be done by a medical student, which has like we have already like obviously we have academic curriculum and everything, so it should look like it can be done. And yeah, I have already mentioned the which are the key focus areas there.
Okay, great, great. Okay. Now comes to this variable thing, right? How many variables are, if you're picking any example variables, is it too many for an undergraduate STS project?
Okay, so from the point of view of STS, I would say in terms of variable, you should probably have only one primary outcome, and you should not have more than two or three
Okay, okay,
expected variables like exposures from it. Okay,
okay.
so if I want to like if I want to phrase it in form of an example, let's say you are doing a study in which you are assessing the screen time of school going students, right? So
Yeah.
yeah, so what outcome you are measuring, it should be only one primary outcome. So let's say in this case, it should be screen time for like daily, what is the daily screen time hours, okay.
Okay,
And
okay,
then you can associate it with other factors like parental screen time, then private schools, government schools, but try
okay.
to keep like it should not exceed more than two or three, or you will lose focus, because that then it does not become possible to conduct it in a such a short frame of time.
Okay, okay. Thank you so much, Shravan. I think this topic would have been clear for our audience. Moving on to the next speaker. Once we are started avoiding, common mistakes, our next step is structuring the question properly, right? Any research question, whatever you have, it should have its own framework, right? So to give a clarity on this, we have Mr. Keetan, on topic Pico Your Path, framing the research that actually works. Yes,
Okay.
Kirtan, you're here.
Good evening, everyone. I hope I give some value. I'll just share my screen right now. Is my screen visible?
Yes, Kirtan, they are visible.
Just a sec. Okay.
Yeah, good to go. You can start.
So my topic is Pico framework. So I wanted to ask you all a question. Make this like very interactive. So why do you think a framework is important? Like we can just do whatever we want, right? Because it's research, it's very creative. But why do we need a framework? Why should we do the same things? You can answer, or you can answer in the chat box.
Yeah, if you can answer out, or you can drop your answer in the chat box. Can you repeat the question, Kirtan?
Okay, why do we need a framework? It's a very creative thing, right? Why should we do the same thing as everyone in the world? Why do we need a framework?
Okay.
Anyone?
Anyone? Yes. Okay, I think Ethan, you can just
Okay,
give
sure.
your own opinion.
So we need a framework because
Okay, okay. Radha, Sanjay Kumar, yes, to keep it organized, to easy to understand.
okay.
Yeah.
How to write? Okay, so that reasoning. Okay, that's awesome. Thank you so much for your response. So we need a framework because it gives us four main things. It makes our study searchable, like the framework, like population intervention, comparator. It's all a different keyword which we can directly use it in PubMed to get more studies for our references. Then it provides clarity. With our framework, if they just read our framework, they can totally understand what our study is about, and we can also check the feasibility through our framework. And then instead of just randomly thinking about a lot of stuff in a minute, we are just going to look at four things which can focus our study and better understandability. So let's go to our first framework. So this is the PICO framework. PICO. First is the patient, population, or problem. Simply, which patient are you going to treat, or which population you are going to take? If you are not doing a population, which problem or disease you are going to solve? What are you studying? That's population. Like you can take diabetes mellitus patients and you can do a research on them. Then your population is diabetes mellitus patients. Or you can just take a specific patient who has a case or just a problem, just a disease. All are mostly the same. Then intervention or exposure. What you are going to do to make their condition better, or you are going to find which makes them better. Intervention. For diabetes mellitus patients, you can give them exercise and you can see what change that brings out. Or you can just expose them to more lifestyle changes and also do a research on what makes their condition better. Research is all about making our patients' lives better. And also ICMR right now is selecting more of translational researches which have direct impact on the patient life more than just anatomical researches. Then comparison or control. This is very important because you're going to do something that is better for the patient which was already not done. Like if you're giving a drug for diabetes like metformin, the research you're going to do should be a better drug than metformin. It's an example, we cannot do much with drugs. So if the diabetes mellitus patient is doing exercise for 10 minutes, you're giving them an exercise for 15 minutes, that's still a good research. It's still a good amount of research. Like comparison, that comparison 10 minutes and 15 minutes, which is better, that you're going to see. So this becomes your control population. The thing that was already done becomes your control population. And then outcome, this is where many people fall. See, outcome is not something that you are keeping in mind. The outcome sure can be something that you have kept in mind, or it could be completely different. Like for diabetes mellitus patients, you're giving 1 hour of workout. That could even be detrimental for them. So it is not always like whatever you think that could happen. So you can have an outcome in mind, but you should not be like strictly that is the only outcome that can come. So you are going to see the effect, reduce symptoms or lower mortality. This is a framework that you can use. Then next. Let's see an example. I'll show you how to see the PICO framework in an actual PubMed study. I took this one study. So the title is FX. Is the screen visible?
Yes, Keertan, it is. You can.
Okay. So this is effects of diet and exercise in preventing NIDDM, diabetes mellitus, in people with impaired glucose tolerance. So first, we can see the objective. Individuals with impaired glucose tolerance have a high risk of developing NIDDM. So what are they use? What are they doing? Purpose of the study is to determine whether diet or exercise. So you can see the population is people with impaired glucose tolerance and a higher risk of NIDDM. Then what intervention are they taking? You can see this in the results. See, in the control group, compared with 43.8% in the diet group, they are giving one group for diet and another group for exercise. See, 41.1% in the exercise group, and another group is diet plus exercise, which has the maximum effects, 46.0%. So this is how you can see. And the comparative they have used is like mono treatment, which is 67.7%. So the population is the patients. Then intervention, they have given like 3 different diet group and exercise group and diet plus exercise group. And the outcome they have reached is 43.8% incidence of that diabetes, which can come from their interventions. So I hope you got that. And then next, can you just choose any population or any orphan drug that you can use? I had this page, These are the list of rare diseases: acral self-healing collodion baby, acrorenal mandibular syndrome, acrocolosal syndrome. These are like very rare diseases, but we don't have any treatment for it. So can we do a research on that topic? Is it possible? Anyone?
Guys, you can answer in the chat box. Yes.
You can just say yes or no.
Radha has said no. Okay. Okay, I'm getting one more no. One more no. Okay.
Okay.
Clinical trials is not allowed. Okay.
Very nice. So why is it a no? We are going to see another criteria called the finer criteria. So this finer criteria is your study feasible, interesting, novel, ethical, or unrelevant? So your study should first be feasible. We are medical students and we cannot do higher clinical trials. So it can be very feasible, like knowledge, attitude, practice studies, and cross-sectional studies. That's what we can do. We cannot do like very higher studies like clinical trials with drugs, orphan drugs, and it should be interesting. This is a very personal perspective. More than interesting, like for ICMR, the subject you're doing should have a very personal interest to you. I did a study called pre-diagnosis of asthma, and we have a family history of asthma, so it's more interesting for me. The more interesting it is for you, the more interested you will be to do the research later. So it should first spark curiosity and contribution to knowledge from you. Then it should be novel. As previous speakers had said, novel is not like that study is never found in PubMed. Novel is just if it's not done in our area, it's still novel. Or is it not done in 10 years' time? As Varshita ma'am told, that is still novel. And ethical. Your study should be ethical. I had few ideas from students like, does sleep deprivation cause depression? So she had the idea to sleep deprive many students and see if they are depressed after a while. That is very unethical. You can never give symptoms to a patient. Like if the diabetes mellitus is already taking metformin drug, you cannot say don't take this drug and take a new drug. Okay, you have to follow the normal protocol. You cannot kill the patient like that. Then relevant is very important because, as I had shown you, the rare diseases that are actually not much prevalent in our India, the prevalent diseases are like tuberculosis, dengue, that is more relevant to our country. In our country, HIV is not much prevalent and it doesn't get selected in ICMR actually. So we should see which is relevant to our area. This is the final criteria. Then, so can we bring all our research in just one line? Not even 4, like not even population intervention comparison, just one line. Can we do that? Yes. So this is the one-line research question formula. It states like, in which population does my intervention compare to normal comparison result in which outcome? With just this one line, we can finish our research. That is what, if we are saying this one line, the person who's reading our research should understand everything. So see here, population meaning who are you studying, then intervention, what are you testing, and comparison, which is the normal control group or standard care that we are already giving as the doctors are giving. Then outcome, what are we measuring, the clinical endpoints or the results that you expect to observe. So this is the one line research question formula. In which population does my intervention compared to the normal comparison result in this outcome? Okay, so I hope you got it. I can show you an example of this one-line research formula in the same thing. So see, in the first line, individuals with impaired glucose tolerance, that is the population. The intervention they are going to do is the diet exercise group, whether diet and exercise interventions in those. Then you can see the comparison they are using to the normal criteria that is there right now, and what outcome they are expecting, that they have put in the results. So this is the one-line research formula. So yes, thank you. I hope you all understood. You can attack me with your questions later.
Yes, thank you. Thank you so much, Kirtan. It was a wonderful presentation.
Yes.
And I think this is a very important part. People will have doubt what is PICO, what is the full form of PICO, how will I figure it. I hope now they would have had some kind of clarity. I do have some questions from my side. I'll proceed it with it.
Yes, yes.
Okay. So if a research question is perfectly structured in a PICO, right?
Yes.
But it fails the feasibility. Okay, feasible check in criteria with final. So what will me like if I'm a researcher, what will I do?
So the first thing is we that's the main problem we students face. We tend to have a larger creative mind and think we can make a huge change. So what we have to do is we shouldn't change the study. We should just change like the feasibility. We can instead of broadening our study, we can take it to just a particular population. We can make it more feasible without changing the entire study. We can reduce the sample size or reduce the sample drug we are going to use. So that's how we are going to do it.
Wonderful. Okay, so the next question I have is, what makes a study novel, even if it's completely not completely unique? We do
Okay.
have this mentality, right?
Yes,
When
yes,
we come with this.
definitely. Yeah, we see a study in PubMed and think they've already done it. What am I going to do it again? As these previous two speakers said, and also I said, a study is novel if it's not locally done or if it's not done in the time period like 10 plus years, as Varshita ma'am told. And I had also mentioned in many points of time. So if it's not done in your area, it's still novel.
Okay, great. I have one more last question. What are the general pitfalls we have in a PICO format?
Okay, I mentioned it during the outcome. We have a specific outcome in mind and think our research should go into that outcome, which makes us go into a bias that we have to get that income. So the outcome is just like a plan. That plan could work or could not work. We shouldn't stop us like just that outcome. We can do it like both ways. This outcome could also come, this outcome could also come. We shouldn't stop and think this is the only outcome we want.
Yeah. Okay. Wonderful. Thank you so much, Keaton. We'll move on to the next speaker. Now we have framed the question. Yes, all well and good. Next step we have is, the major challenges designing the methodology. So to take into that path, we have Mr. Santosh coming with a topic with a blueprint mode, building a methodology that holds up. Over to you, Mr. Santosh. Yes.
Is my screen visible?
Yes, it is visible.
Okay, and good evening, everyone. I am Santosh from Sri Venkateswara Medical College, and I'm currently studying in third year. And my STS project was selected at 2024 and 25 as well. So, actually, basically, many students have innovative research ideas, but the real challenge lies in choosing the right study design and methodology. even a stronger research question can fail without proper planning. So understanding about each research design, study designs is much more important. So there are several research designs, but pertaining to ICMR STS, we need to know about 4 main research designs. Okay, one is cross-sectional, another one is case control, cohort, and interventional. And first, cross-section study, it is nothing but collecting the data from the population at a single point of time. We can go with the example. Okay, first we are testing like prevalence of hypertension among final year MBBS students in a college. So here we'll be measuring the blood pressure as well as we'll be measuring the stress levels with the help of a questionnaire data collected during only one visit. Okay, this is an example of cross-section study, and also this type of study is more commonly done among the MBBS students. And what is the best when it's best used is if you want to know how common something is, or you want to study the associations. For example, association between the stress and the sleep and diet versus BMI, you can go with cross-sectional study. And then comes the case control study. In the case control study, you want 2 groups. Okay, one is cases, another one is control. So cases are nothing but the population group which have with particular disease condition. And the controls are nothing but those population without the particular condition. For example, association between frequent junk food intake with which is associated with acne among these medical students. So in this research question, we can see that students with acne is the clinical condition through which we can categorize these population into group A, that is the cases. And those students without acne, we can take them as controls into another group B. Okay, you can use this case control study in the disease and outcome is rare, or you want to study or identify the possible risk factors. And also this case control study is called as a retrospective study because you will be collecting the past history data. Okay, so the major limitation is the recall bias. That is, you cannot ask the patients to recall the whole past history. As we all know, as a humans, we also have that forgetfulness, right? So this recall bias is the major drawback in the case control study. But there comes the cohort study. A cohort study begins with exposed and unexposed groups, and we need to follow up them, the patients, over the time to observe who develops the outcome. In the cohort study is also called as prospective study because in the cohort study, we'll be selecting the population who doesn't develop the disease, but they have the difficulty, they have the possibilities of getting the disease and they have the exposure to that particular condition. For example, do MBBS students sleeping less than 6 hours per day develop higher stress scores over one academic year compared to students sleeping more than 6 hours? In this scenario, we are comparing the 2 groups. One is MBBS students sleeping less than 6 hours per day. Another group is MBBS students sleeping more than 6 hours. Okay, in this condition, the stress score levels were not developed immediately. So after a period, for example, we are analyzing the students throughout the 1 year, which we are following up. And at the end of the 1 year, we can find how the sleeping time has affected their stress scores. And we also do have a limitation in this cohort study, that is, we cannot follow up throughout the year each student. If we also follow up, there are cases that students may drop out from our study. And there comes the interventional study. It is like one of the higher level of study design when we compare to all the 4 levels. In this research study, we'll be comparing between the groups. We also do intervene. For example, effect of a 10-minute guided meditation sessions before exam on stress levels among MBBS students. Okay, it is also called, we have a term like randomized control trial. Okay, here also we'll be taking 2 groups. So one group will be like taking both are exam going students, both the groups. In the first group, we can ask them to meditate for 10 minutes before the exam. And in the second group, we can ask them to directly write the exam. So we, at the last, we can able to compare the effect of the meditation among the two groups. And in this case, we are using the intervention as the 10-minute guided meditation. Okay. And the quick tip to the student is, if you want to use a cross-sectional study to know how common a condition is, if you want to know about the case control, that you can go for when you want what causes it. And if you want to know about what happens over the time, you want to know the evolution of the disease, and you can go with cohort study. And if you want to know, does this particular intervention helps the students, and what this particular intervention makes a difference among the students, you can go with the interventional study. So now we came to know about the different study designs. Now we need to know how to match your research question to the right study design. For this, you need to ask three basic questions. Okay. First is, what is the time direction of your study? If you're going to collect the samples in a particular single point, you can go with cross-sectional study. If you're looking into the past exposures, then you can go with the case control study. If you want to follow up the participants into the future, like what is the outcome in the future, you can go with the cohort study. And if the researcher introduces any intervention, you can go with the interventional study. And when it comes for the intervention study, many students have an idea mindset of only giving any particular drugs to the drugs for the particular condition of the patient is the intervention study, but it is not. Even a simple thing, that is a meditation or not using the mobile phones before going to sleep, these are also basic interventions which as an undergraduate students we can able to perform. And how common, second question is, how common is the outcome? If you're doing a study in which the rare diseases or the outcome is very rare, you can go with case control study. If you're doing a study in which common conditions or the outcomes we can observe in a very short term, you can go with the cross-sectional study. And if it needs a longer term of observation of the risk factors, you can go with the cohort study. And third question is the important question, that is, what exactly do you want to find out through your study? So if you want to find out how common a condition is, you can go with the cross-sectional study. What factors are associated with it, you can go with case control study. And does this exposure leads to the disease, you can go for cohort. And as we all know, the intervention part deals with the randomized control trial or intervention study. And the simple tip for the beginners is, before finalizing your topic, always ask that, am I measuring the prevalence or identifying the risk factors or observing the outcomes over the time or testing an intervention? So now we need to know about the three basic terms. One is independent variable, dependent variable, and confounders. So what is, you need to know the three order which I'm going to say, that is, what is the cause, what is the effect, and what else can influence the both cause and the effect. If you get to know about these three terms, these three very independent, dependent variables and confounders are easy for you. Okay. First, we can go with independent variables. This is the factor you think may cause or influence the outcome. Independent factor always deals with the outcome. The simple question you need to ask is, what I am testing in my study? The answer which you get is the independent variable. And for the dependent variable, it is the outcome variable. Okay. It is what result am I expecting at the end of my study? The answer, the factor which answers this question is the dependent variable. And if we can also take a common example. Okay. Does increased study time increases the anxiety among MBBS students? So in this question, so what is the independent variable is what you're trying to find out. That is the increased study time. Okay. And then the dependent variable is what is the outcome. That is, you want to find whether this increased study time leads to the increased anxiety among MBBS students. So this anxiety is the outcome, which is nothing but the dependent variable. And there comes the confounders. Confounders are nothing but it's a bit confusing part for the beginners. It's the third factor which affects both independent as well as the dependent variables. So we can take an example that does coffee intake cause insomnia? In this, you can find out like students drinking more coffee have more insomnia, but also it doesn't stops with the coffee intake and insomnia. Coffee intake is the condition which you want to start with, right? It is the independent variable, and insomnia is the final outcome, which is the dependent variable. But there is other factors which can affect these things. That is the age of the student, the gender, the stress which they are undergoing, the sleep duration. These are the other factors which would affect the insomnia. So we should also take care of these conditions. And there comes the most important part, that is the inclusion and exclusion criteria. So how much you mentioned detail about the inclusion and exclusion criteria in your protocol, it's you are adding as much weightage to your protocol. Okay. The inclusion criteria is nothing but who can participate, and then exclusion criteria is who should not participate. That's it. Okay. In the inclusion criteria, for example, we can take an study, for example, that is prevalence of myopia among first year MBBS students. In this study, I will be including the MBBS first year students of our institution, and the age which I will be taking between the students should fall under 18 to 22 years. And there comes the consent. It's the most important part. Okay. If you are doing any study among the students, you must need to get the consent. That too, why I'm choosing the study design that comes design 18 to 22 years is you need to get consent from the students alone. If you're doing any of the study which includes this people below 18 years, you need to get a form that is called as asset form, from which should be signed by the parents. So in this condition, prevalence of myopia among first year MBBS students, you're choosing the MBBS first year students, age between 18 to 22 years, and students who are willing to provide the informed consent. Okay. And the exclusion criteria is nothing but who should be excluded or avoided. So for the same study, we can use that students with congenital eye disease, we need to avoid them to avoid incorrect results, and history with recent eye surgery, and with incomplete questionnaire response, and students who are unwilling to participate. So these are inclusion and exclusion criteria. Okay. And tips for writing the good criteria is you should always be so specific in this inclusion and exclusion criteria. You need to mention the age range, the study population, in which location you're going to conduct, and in the study period, and the consent status. Also, you need to try to keep them logical. Okay. For example, if you're studying the sleep quality, excluding the students on sedative medication is reasonable. So like this, you should always be logical. Okay. And also, you need to avoid unnecessary criteria. Too many restrictions will also reduce the sample size and make the requirement so difficult. And sampling methods. And sampling means nothing but selecting the participants from a larger population for your particular study. Since it is usually impossible to study everyone, researchers select a small particular group who will be the sample and who will be representing the whole population. Okay, there are three types of sampling methods pertaining to our ICMR STS. One is convenient sampling, purposive sampling, and systematic sampling. In convenient sampling is nothing but participants are selected because they are very easy to access and readily available. The simple idea is take whoever is easily available. For example, first year MBBS students present in the anatomy hall during the data collection. Okay. And the advantages are these are simple and quick and easy for undergraduate projects and require lesser time and resource. But there are few limitations in this sampling method. That is, there are higher risks of bias as we are just randomly selecting the population. They may not represent the entire population, and the result may also not fully generalize. Okay. And also next comes the purposive sampling. In this, participants are selected intentionally because they have specific characteristics relevant to the particular study. The simple idea is choosing only the specific group you want to study. We can go with an example. Selecting only smoking MBBS students for a study on smoking habits and lung function. So in this study, we'll be picking up only those students who are smoking among the MBBS students. Okay. And the advantages are this particular method is useful for studying a particular subgroup and focused on targeted sampling. Okay. And there comes the systematic sampling. And this method is more useful, and if you mention this systematic sampling, it will increase the weightage in your ICMR STS protocol. Okay. And in systematic sampling, participants are selected at regular intervals from a list. For example, we have 150 students in a class. We are going to take a population in first year MBBS students, and there are 150 students. But you cannot collect the whole data from 150 students. So randomly, you want to collect 50 students alone. Okay. For that, for example, so you can take every third student from the attendance register. For example, if a person with the roll number 3, and then you can go with the roll number 6, 9, and keeps on going. So in this way, you can sort out the 150 students to a 50 student. So in this way, you can sort out and take the sample, and systematic sampling method is highly validated and it's more specific also. Okay. And the advantages in this particular method is it is more organized and scientific and less biased compared to the previous method which I spoke about, and easy to perform if a list of the name list is already readily available. And next comes the important thing, that is basic sample size calculation, in which many UG students feel it difficult to do. Okay, but it is the easier part. Nowadays, we need not want to do step-by-step calculation in pen and paper method. We have lots of platforms, validated platforms in the Google to calculate the samples. Its sample size is nothing but how many people should be included in your study. And the importance is that if you are taking too few participants, results may not be reliable. And also, if you are taking too many participants, there is as you are also studying MBBS, so you'll be having a regular curriculum also. So it's unnecessary work and time will be consuming. So the aim is to choose a number that is enough to detect a real result. Okay. So size mainly depends on how common the condition is, how big a difference you expect, how accurate you want to study to be. And there are many online platforms like GPower, OpenEpi. In this, when you open this, like for example, if you take OpenEpi, if you open in the Google, we need to just find out the mother article first of all. As we cannot do any study as very newly as a first study, like we will have similar reference study available in the PubMed or Scopus database. So first you need to pick a reference article. In the reference article, you'll be having the prevalence of particular condition. If, for example, if I'm doing any study related to the dengue, I'm picking up a reference article from the PubMed database regarding to the dengue severity. Okay. In the particular paper, they will be mentioning about the prevalence of dengue in the particular population. If we take around 40% of the population have dengue, you need to mention 40 in the prevalence space, which was given in the OpenEpi. And and also you will be having many categories like lots all the study designs. If you're going with the cross-sectional study, you can choose cross-sectional, or you want to do case control, it will be going on. Okay. So the main thing is you want to know about the what is the prevalence from the mother article. And the common apps which we use is like OpenAPI, GPower, and then Rasasoft and WHO calculators.
Okay, Santosh.
Yeah.
I think the time is running out. You can pass it up. Yeah.
And the questionnaire
No,
based study, that is, yeah, and finally this questionnaire,
yeah,
that is,
yeah.
there are two types of questions, validated and non-validated. And you can go with the validated questionnaire for that, because we have questionnaires like DAS questionnaire, so you can go with it. And this what I want to cover. So Manoranjani.
Yes.
Yeah.
That was a very good presentation. I think methodology is something that we all will, crash out and have lots of doubts. So I do
Exactly.
have a few questions from my uh, point of view
Yeah, sure.
and the students that I got. The first question I have is, why is knowing about a research design and a methodology is important in generally? I can just, look into a parent article and I move on, right? Could you explain the major study designs that are focused and where it is, used in our undergraduate research level?
Yeah, it's actually a good question. That is, research methodology is the basic. Actually, this is the foundation of a study. See, if you have everything is proper, but if the research methodology is not good, is none of your it will not going to work out. Okay, research methodology will give what you're going to do, how you're going to proceed with your research, and then it gives a systematic idea how will you go through the process and you will be completing it. So
Yes.
first thing is you need to just know about generally what are the research designs, and then you can go on it.
Okay, wonderful. I have second question.
Yeah.
How can a student, researcher decide which study design is best suit for their research question? Because they'll be having their own niche, right? Their
Yeah.
own area of field. So
Yeah.
how we can design study design?
Actually, in first year and second year students, they might feel a little bit difficult because they will not have a subject community medicine. So the basic thing they want to ask the question is, if you want to find how common a condition is, so you can go with a cross-sectional study. If you want to look onto the past histories and you want to take a retrospectively, you can go with the case control study. And the third comes the, if you want to observe a patient throughout, and you can go with the cohort study. If you want to intervene a patient, then you can go with the randomized control trial or interventional study. So this is the basic idea which they can have.
Wonderful. I have one last question I have.
Yeah.
Okay. Let's say a sample size calculation. It generally seems to be difficult for the beginners, right? Like when I was my first year, it was quite difficult for me. What practical approach should an undergraduate student, to follow while deciding that particular sample size for their studies?
Yeah, the thing is, even I also felt difficult when I was in the first year. So the thing is, and then if you explore, there are lots of platforms available in the online which can calculate automatically. So previously they will be calculating the pen and paper method, doing all the calculations. The only thing you want to know is how much prevalence is present from the mother article. If you just find by doing a literature review, then you can easily calculate the sample size.
Okay, wonderful. Thank you so much,
Thank
Santosh.
you.
Guys, whatever doubts you can have in methodology, you can post it in the chat box. Okay. Moving on to the our next speaker, Miss Lalita. Now, a strong methodology is the backbone of any proposal we know, but presenting it clearly is what makes the paper, you know, make it more understandable and skills comes together. So we have Lalita to broaden our topic from blank page to proposal, writing research that gets approved. Yes, Lalita, over to you. You can go on.
Firstly, good evening, everyone.
I'm Lalita, and today I will be speaking on one of the most important parts of ICMR STS journey, that is writing the proposal, uploading the proposal, whatever. Like you guys should be like tense right now in this one. Many students have interesting research ideas, but the real challenge begins when they open a blank Word document and ask themselves, where do I even start? So, and honestly, that feeling is completely normal because I have numerous files like that. Because any proposal writing is very different from writing an university exam. In exams, we reproduce information, but in research, we organize thoughts very scientifically. Today, I'll walk you how to structure. One sec. Today, I'll walk you through how to structure an ICMR STS proposal section by section, how to write it clearly, what reviewers actually look for, and the common mistakes students should avoid. First, let's understand one important thing. An ICMR proposal is not just a document. It's a scientific story arranged logically. So this picture I've got it from one of the ICMR STS PDF, which or the documents they have uploaded. So many people have like doubts on what do you call the word limit and all. So basically, here it goes. Every section has a purpose, and the introduction basically it is like 300 words at max, explains you the problem, like explains the problem properly. The literature review explain what is already known, and objectives explain exactly what your study wanted to achieve. Methodology, how you plan to answer the research questions scientifically. Ethics ensure patient security and responsible conduct, and references show that your proposal is evidence based. Think of it like constructing a building. So, if the structure is organized, even a simple study looks professional and convincing. But if the structure is confusing, even a strong idea may get rejected. Now, among all the sections, the introduction is one of the most important one because this is where reviewers decide whether your topic actually matters. A strong introduction usually follows three steps: hook, gap, and rationale. First comes the hook. You begin with a statistic, a trend, a public health issue, or a clinical observation. Like previous speaker said, it can be like anything, anything of your own choice: public health, reproductive maternal health, AMR, zoonotic diseases, anything. Now, immediately, reviewers will understand the seriousness of this topic. Now, next comes the gap. This is where the research truly begins because research is not about repeating what is already known, it is about identifying what is still unknown. So, maybe like a certain population has not been studied, a local data which is unavailable, awareness which has not been assessed, and or previous studies which had limitations. Then comes the rationale. Why your study should be conducted. Will it improve awareness or generate local evidence, support of preventive strategies, and help future interventions? So basically, a good intervention does not simply provide information, it builds an argument for why the study deserves the attention. So, now, once the problem and the gap are identified, next step is the literature review. And on one mistake, any student or many student making is to try reading everything. That usually creates confusion instead of clarity. That purpose of literature review is not to prove how many papers you read. It is to show you understand like what previous studies has found, then what method they have used, the key findings, existing research gaps, and landmark studies or points if it is important. And if for STS proposals, around 8 to 15 references are very like sufficient. Focus on recent and relevant studies, then usually use reliable databases, basically PubMed, Google Scholar, ResearchGate. Avoid copying abstracts directly or non scientific websites. Don't do ChatGPT and Gemini, guys. And remember, good researchers do not read papers. They read for patterns and gaps. Oh, sorry. Next comes the heart of your proposal, that is objective. If objectives are unclear, the entire proposal becomes confusing. So, objectives decide your methodology, data collection, statistical analysis, and even conclusions. A good objective should be SMART: specific, measurable, achievable, relevant, time bound. So, specific, clear, and focused. Measurable can be assessed or quantified. Achievable, realistic within the STS duration. Relevant, connected to the research problem. Time bound, defined within your study period. Students should also understand the difference between primary objective and the secondary objective. So, primary objective is nothing but the main aim of your study. Secondary objective explores the additional associations or comparisons. For example, primary objective you can have to assess the awareness regarding antimicrobial resistance among undergraduate students, whereas the secondary objective can be to evaluate the association between self-medication practices and AMR awareness scores. So these are like comparing or like associating with your primary aim of the study. But basically avoid vague objectives like to study anemia, to assess the knowledge, like that. That tells reviewers almost nothing, right? The more specific your objective is, the stronger your proposal becomes. Now let's move on to the section students fears the most, and personally even me: methodology. But methodology is actually very logical, and it turns out to be very simplified with your guide's help. It simply answers one question: how will you scientifically conduct the research? First, mention the study design: cross-sectional, case control, comparative, KAP, whatever it is, and define the study population. So, who are you studying? Be it medical students, school children, patients, anyone. Then mention inclusion and exclusion criteria very clearly, as my previous speaker said. Next comes the sample size. Then keep it very realistic. Remember, ICMR reviewers prefer feasible projects over unrealistic, ambitious plans. Then explains the study tools like questionnaires, surveys, interviews, or even laboratory investigation data if applicable. Finally, briefly mention your data analysis. Do not overcomplicate your statistics just to sound very scientific. A methodology section should make reviewers think, yes, this study can actually be realistic and feasible and can be completed within the stipulated time. Now, even the best methodology cannot proceed without your ethics approval. By now, you guys should know what is IEC in your college and all. So basically, research involving human participants requires ethical responsibility. This is where the Institutional Ethics Committee or IEC becomes very important. The IEC reviews whether the participants' rights are protected, confidentiality is maintained, risks are minimized, and the study is ethically justified. Usually, the researchers submit in your you upload basically in your ICMR STS portal the proposal, patient information sheet, consent forms, questionnaires. I guess if the time is very constrained enough, like not enough to get your IEC approval, you can actually submit an undertaking IEC form asking your management or your seniors if they've already did it. One very important rule every student should remember is data collection should never begin with before your ethical approval. Ethics is just a paperwork, but it is what make research trustworthy. But now, closely related to ethics is the informed consent, as my previous speakers have also discussed. Participant must clearly understand the purpose of the study, what participation involves, possible risks and benefits of your study, confidentiality, and the right to withdraw any time. For adults, the participant signs the consent form. For minors, parental consent, that is, assent form, is usually required. Then, informed consent is not just taking the signature, it is respecting the patient's autonomy and dignity. A patient is not just a data point. This is what we all have to remember. They are human being placing the trust in the researcher, and basically they're helping for our research. And another important issue in research writing is the plagiarism or plagiarism. Sorry if I mispronounced it. Many students think plagiarism only means copy pasting entire paragraphs, but plagiarism or include close paraphrasing someone else's work, using ideas without credits, or improper citation from your literature review papers. The safest approach is read, understand, and write in your own words. The tools like Turnitin, iAuthenticate help detect your similarity, but ethical writing matters more than simply reducing a similarity percentage. Research loses credibility the moment it loses its originality. Finally, one thing can make a proposal writing much easier is using a reference manager. That is, tools like Zotero and Mendeley helps researchers. Commonly used or beginner friendly is Zotero. Even many of us or me use Zotero here. Organize papers, we store articles, insert citations automatically that comes in your Vancouver format, and generate bibliographies instantly. So instead of manually typing every citation, these tools can save enormous amount of time. For medical research, again for ICMR, the preferred is Vancouver style. Learning reference management early makes research writing very more efficient and professional. So, as we conclude, I want everyone to remember this. ICMR reviewers are not expecting an undergraduate to produce a revolutionary discoveries. They are looking for some clarity, structure, ethical awareness, so scientific thinking, and feasibility. A proposal becomes strong not because the language sounds complicated. It becomes strong because the question is meaningful, the objectives are clear, the methodology is realistic, and the writing is organized. Every approved proposal once started as a blank page, as I told you, and every researcher once doubted themselves. So don't wait for the perfect idea. Start observing around you lies your topic. Start questioning, start writing. Because great research does not begin in laboratories, it begins when someone refuses to ignore the problem. Thank you.
Thank you so much, Lalita. It was a very wonderful, and I think proposal writing is again one more stepping stone in research, I guess. I hope it was very useful for our audience. So I have few questions for you, Lalita. Shall we?
Yeah, Manu.
Yeah. So the first question I have is, what is the most common reason STA proposal gets rejected out?
So basically, as I told or discussed in my presentation, the most common reason is lack of clarity. Usually, the topic must be like maybe good, but objectives are very vague. Methodology is unrealistic or not feasible. Proposal fails to explain the actual research gap mainly. So a simple, feasible proposal with strong structure often performs better than an over ambitious topic.
Great. Yes, great. That was a good answer. Second doubt, again, it's from the students. How much innovation is actually expected from an undergraduate STS proposal level? Yeah.
So again, ICMR does not expect any groundbreaking or revolutionary discoveries from undergraduate graduates, mainly first and second years. Innovation can be very simple: studying a new population, assessing your local awareness, adding a comparison, using a small intervention like I use in my own ICMR study, HemoQ intervention for analyzing your high hemoglobin index, then as or exploring an understudied issue. So novelty does not always means complexity, right?
Yes, 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 completely. Last but not least, what advice would you give our students who are starting research for the first time, stepping into it? Yeah.
Start simple, guys. Choose a meaningful question, a feasible methodology, a supportive mentor. My mentor, or like you know, right? Our mentors means a lot. Like they are the one who guides us throughout it. And research becomes easier once students, stop fearing the process and start approaching it step by step with proper guidance.
Wonderful, wonderful. Thank you so much, Larita. Okay, we already run out a lot of time. Now here comes the most awaited part. Audience round, yes. So whoever feels free, you can just on your mic and you can bombard your questions. We have wonderful speakers and who can just clarify all your doubts. Yes, go on, guys. So before that, I'll start from the first question that if it as asked, how to frame a research question for KAP study, for example, KAP of practice of any particular topic among undergraduate. So he is generally asked how a KAP is done and how to proceed. So as delighted speakers, anyone wants to answer, you can just on your mic and start answering it out. Yes. Okay. Okay. So I'll help you out. I'm the moderator over here, so I figured out few answers for you guys. First of all, a KP is what? It is knowledge, attitude, and practice, right? You just have to have this basic formula in your brain, okay? What is the level of knowledge, attitude, and practice we have regarding in which population among any undergraduate or any students, nursing students, or paramedics? This is general formula. What is the level of KP we have regarding particular topic among which population, right? So whenever you go for a KP, just make sure that you're looking into certain criteria. Number one, okay, I think I'm audible, right? Yeah, yeah, okay. You have to look into certain criteria. Number one, topic. What is the topic you're choosing? The target population. Specify the population. Then the setting and the place, whether it's a tertiary care hospital or it's going to be in your particularly in your OPD or a ward. You have to specify the study setting and the time period, of course, and associated factors and variables. So how will I go? I have a template for you guys. What are the KAP regarding any kind of let's take infection related kind of thing, hand hygiene, very simple. Yes, regarding hand hygiene among the undergraduate medical students in tertiary care hospital. Now here I have the entire question over here. It's a KAP study in with what on what I'm doing. I'm doing on hand hygiene among which population under the undergraduate medical students in which setting I'm doing in the tertiary care, teaching hospital. This is how you're supposed to derive a generalized KAP into a structured format. I hope it is clear. So I can give you one more example. Now, someone comes with me an idea. Study of social media, in medical students. It's very weak and very broad. I have no idea. So second we have is a better one, like assessment of KAP regarding social media addiction in undergraduate medical students. Still, it's good, but still it's incomplete. You can see. Now I'll go for an even good one. Assessment of KAP regarding the responsible, social media use and its association with sleep quality. I'm actually connecting with a variable over here among the medical students in tertiary care hospital. So this is how completely frame a KAP kind of research question topic. And second doubt someone has asked, um, okay. Someone has asked whether I need to attach the questionnaire for the ICMR. Yes, it's better to attach a questionnaire for KAP study or any kind of studies. A simple questionnaire, whatever you're going to, whoever population you're taking, standard questionnaire you need to attach in the portal. They've asked separately a column for a tech guess. After the undertaking statement informed concerned, they have asked to attach the questionnaire. If your topic is relevant on that. So yes, definitely attach the questionnaire in it. Third, we have sir, do we need to submit questionnaire? Yes, that is done. How to do a proper literature review search in PubMed. So if our speakers have any, answer for this, you can go on. How do I do a literature review? That is what they've asked in advanced search. Next we have is, okay. Santosh, I think this question is for you. Where does ICMR stand when it comes to prospective cohort study for 6-month duration? Are they encouraged by ICMR reviewers?
Uh,
Uh,
like ICMR reviewers generally do not reject a study just because it is a prospective cohort of 6 months duration. Okay, first they should understand that. And what matters more is whether they are going to do the follow-up period scientifically justified, whether if it will be feasible for the first or second year students, and they should clearly explain in the methodology itself. Okay, for ICM or STS, the similar student projects, shorter prospective studies could be acceptable. And also a 6 month cohort study, as the person has indicated, is commonly acceptable in studies involving like they're calculating the stress or sleep or exam effects or any post-interventional outcomes or infection follow-up. But however, if a disease outcome normally takes few years to develop, okay, so reviewers may question whether 6 months is sufficient to detect the meaningful results. And also the key is not the duration alone, it is whether the duration is adequate for a research question and justified scientifically in the protocol. So you need to just have a glance into it.
Thank you so much, Santosh.
Thank you.
Coming to the previous question, okay, what kind of someone has asked about the literature review part, right? How will I do a literature review in advanced? Okay, so I have few document on how proper literature review can be done in the group. Generally, in advanced tool, what you do is you open your advanced search builder. Yes, we have this
Uh,
basic
Manu,
thing that we do is booleans.
ma'am,
Yes,
I
yes.
can show it, I guess.
Yeah, yeah. Please
Okay,
want
I'll
to
just share
want
my
to.
screen right now.
Yeah.
Is it visible?
So yes, Keithan, you keep sharing it. Yeah.
Wait a sec, I'll come from the beginning.
Great.
Okay, so we are searching PubMed and we are going in. Then you can see this advanced here near the search bar. So we have to click
Yes,
into
yes.
that. Then we can go here, we can enter a search term. My favorite is diabetes, so we can do that. And here you can see and or not. So you can see and we mostly use and because we need a lot of factors and then only we can see a lot of studies. So diabetes, lifestyle, then weight loss. Okay, so we can add these and we are using or also we can add whatever we want. Then if we are going for the search, the articles will come. Like that we can add and it will show in the bottom. So anyone, is it fine?
Wonderful, Keithan. Thank you so much. Yeah, that's how it works, guys. Simple. You can just use the boolean to get a clear context. I have one example. Let's say KAP, artificial intelligence, medical students. Three keywords are there. Okay. So how I can search is instead of putting everything together, dump it up. First, I'll start with, as Keithan said, like diabetes, we'll have here artificial intelligence or specify what kind of thing you need, generative AI, ChatGPT AI, or whatever it is, whatever tool they're using. Then plain text. I have knowledge means knowledge or attitude or practice. Here I'm using the or boolean. After that, I have in which population? Medical students or undergraduate medical students. I'm using a or boolean again. Now I will just add up all these. AP or attitude or knowledge or attitude or practice together, and I will use artificial intelligence or generative AI, and again I will use medical students or undergraduate medical students. This is how it generally works. How to use the booleans. Good to go. The next doubt we have, uh, just hold on a few minutes, guys. It's just going to get over. I think doubt session is very important, so you guys cannot miss it. Give examples for Pico. Give Pico examples for KAP. Keaton, can you look into how a Pico generally works on KAP?
Okay, so
Yes.
Pico is actually, you can do the same for it. Pico, which population you're going to do. If you're doing on medical undergraduates, that will be your population. Then for intervention, you're going to see what is the knowledge for them. So it becomes an comparator. So you are going to see the awareness, and if there's less awareness, you can say you are going to give more awareness. Then for comparator, from the before it was like they had less awareness, now they have more awareness. So that is the comparator you can use. For the outcome, also the same, like there's more outcome, there's more awareness for the students, or there's more awareness for the patients we are going to see. So I think it's the same.
Okay, wonderful, wonderful. Thank you, Kirtan. I hope the doubt is clarified. Okay. Next, we have Radha's question. I think this will be suitable for Lalita. You can just give it a try. How to write a strong proposal? It's completely your topic, I guess. How to write a strong proposal and how to choose a proper academic words and write the important points in a proposal. Yes, Lalita, you can. Are you here? Okay, so Lalita, you just try to keep the answer ready. That is how to write a strong proposal. They just asked a broad question. Second question
Mano,
they
am I
asked
audible?
is, you ready?
Yeah. So basically,
Okay, go on.
as I've already like showed to my presentation also, ICMR actually gave a proper PDF, in constructing a proper proposals outline with proper, the criteria for maximum word limits and everything. And I actually, again, if possible, through you, I can share the PPT also, like if people needed it. Uh, Probably when you structure the proposal properly, like following all the guidelines and all the tips or something, whatever we have said, it would come into a very good proposal. And I'm saying you just keep it very minimal, very like structured properly. That's it.
Again, guys, I wanted to mention this. So it's not about how strong, or you can make a really strong proposal, but there's also an element of luck in ICMR. About like 2 lakh or 3 lakh applications, only 2% gets selected. So if it doesn't get selected in ICMR, it doesn't mean it's a bad project, or it doesn't mean it's a bad proposal. So there are other funds. This is not the only fund. So don't give up if it's not ICMR. It is a strong proposal, even if it not gets selected in ICMR. Keep that in mind.
Yeah, as Kirtan said that even if your project doesn't get selected, it is not that you want to just discard all the proposal. You can just carry out forward. And even my friends who had rejected the proposals, they carried out and they still had published in a Scopus Index journals. So it is not about the selection. It is just in fund. You should just have a mindset that it's a funding part. So it is just you can carry out and you can still publish it.
Wonderful. Thank you, guys. Thank you so much. That was a wonderful answer we had. I think they have turned into motivators. Yes. And we have next question from Radha itself. Is there any useful AI tools used to refine our research? Okay, before I think I can answer this. Before looking into AI tools, yes, make sure one thing that you're not completely relying on AI. Rather, you're just using it as a side tool to clarify your own doubts in research. I have 3 tools over here with me. You can just, give it a search and you can just try it. And again, I'm not completely, asking you guys to rely on it. Very sure on that. Number one, you have is consensus, that is CONSENSUS, consensus. This particular tool I have personally used actually. This is useful for best for evidence based. If you need any evidence based answer from any particular paper, for example, if I have a generalized topic like does the sleep deprivation affect the performance in medical students? It is very generalized, right? If I put this into consensus, it just gives me, tells that whether great for identifying whether topic already exists. Previously, how many topics are, how many studies are done before, and it's faster than reading 50 abstracts initially, so you can give a try on consensus. Second we have is elicit. Elicit is actually good for literature review. It's like, let's say, find a paper on KAP regarding the artificial intelligence knowledge among medical students. So, what this elicit tool does is that is, it gives exact number of population outcome, the method. So, yeah, You will get in a kind of literature tables. So you can try that also. I have told about consensus and I have told about LSIT. The third is research rabbit. This one my professor during some CME, I guess they've said this. Research rabbit is pretty good. It's
Sorry,
like
what was the
connecting
second one?
Okay, second one is elicit, ELICIT. Okay, the first one was consensus, CONCUS. You want to find in literature review, and if you want to do find some gaps, you can get the assistance of this. Yeah. Third you have is research rabbit. Research rabbit is quite famous, I guess. Now, what usually PubMed does is you go inside and you will find papers, all the papers inside. Research Rabbit is more like a Spotify of a research paper. You can find the relation between each and every paper. So you can also give a try on Research Rabbit. I hope it was useful for you guys. Like for example, if you need to look into related paper, any finding research gaps, again, you can use. Once more, don't completely rely on AI tools. They are just some side tools which might help you out. But you also have to remember the basic and traditional way of how we are doing our finding our research in from literature review to topic selection, everything. So yes, I hope it is clear. Okay guys, let's go more fast. I few more questions. Should the topic be submitted first and the research be done later? Okay, so coming to ICMR STS, is anyone wants to answer this question or they like it?
Yes, see,
Yes.
the topic proposal is just pitching out your idea. If the proposal gets selected, then only you can start the research. Like even if it after it gets selected, there's the institutional ethics committee that should give approval. Then only you can start the research. That is very specific. You are just proposing your idea. If it gets selected, then you are going to the IEC committee of your college, and then only you can start your research.
Wonderful. Thank you, Keaton. Thank you. Okay. How to write a reference taken from government guidelines? How to write a reference taken from government guidelines? That's the first question. Does anyone want to
Manu,
answer this?
I would like to take this. Just like I've informed, the proper reference styling is the Vancouver styling. So basically, when you open your PubMed, like Kitan showed, you open any of your proper free cited PMC article, you get that site, a link. And when you click it, you will get a proper citation of that particular study. You can copy directly from that and put it because, and only the, I think the DOI, that numbers are not necessary, but if it's okay, have it. Cover styling is nothing but, oh, thank you, Keaton. You can actually show that. Or, sorry, it's Manu. Is it Manu doing it?
No, it's Keaton. You can proceed, Lalita. Yeah.
Ha, okay. So apparently, when you do that, and that comes in a proper Vancouver styling, Vancouver thing. So that's what Vancouver is nothing but the author's name and the study's name and in which year it got published. This is called Vancouver styling, and this is where this is the proper thing, proper format you have to upload your reference.
Thank you so
Just
much,
copy
Lalita.
it. Yeah.
Wonderful.
Excuse me?
And properly cite like matlab you just have to in your introduction or in your when like just like one of the speakers said, when you're doing from your mother reference paper, the sampling size and all, you just have to put it in the proper brackets, cite the number, proper number of your used reference article.
Thank you, Lalita. I think I heard someone's voice. Is it Shreya? Yes, Shreya. What doubt you have?
Yeah, I had a doubt if my references, it wasn't a research article, a PubMed article, but like something like a WHO report or something. How do I cite it?
Okay.
Okay, so I would like to take that question. I can show you actually. Wait just a second.
Yes, Shravan, please. And
Is it visible? Is the screen sharing on?
No, it's not visible.
Okay, someone, you just started over, Shravan, and tell me. Keaton, just cross-check whether the screen is visible.
Okay, so you can just like the way they say the way you write in the Vancouver style, just that in the same format you can write it. For example, I can give an example. If you are quoting an article from, let's say, some guidelines from the government or WHO. So you can, for example, an example would be like International Diabetes Federation, IDF Diabetes Atlas, 11th edition, Brussels, International Diabetes Federation 2025. In this manner, you have to quote it. Or if it is a guideline from the ministry, if you are assessing some program that is being given by the government, that is been run by the government, you can quote, like reference it as like Ministry of Health and Family Welfare operational guidelines for that and that Government of India along with the year. So that is the manner that you can quote if there is any government guideline, or if you want to quote any reports from like WHO or any other association like American Diabetes Association or whichever you are dealing with. So I hope that clears your question.
Okay, wonderful. Thank you, Keaton. I hope, Shreya, your doubt is clarified. Yes?
Yes, ma'am. Thank you.
Yeah. We have few more questions, okay, or 2 or 3 questions. Then we'll wind up. Any other questions you have, you can just post it. Either you can DM my number, or you can, post it in our ICMR STS series group. Okay, so any tips to refine such research article? Again, Radha, yes, Radha, we will sort it out with you. Can you explain cross? Yeah, Keaton, you want to go take it?
There's another question. Can proposals be given all year round, or there are deadlines? The deadline is 30th May this month.
Yeah. Yeah.
Usually they will give a time extension of 2 weeks, but don't rely on it, because in past 2 years they gave a time extension of 2 weeks, but it might not be the same in this case. So try to prepare before 30th itself.
Okay.
Also, I would like to add on to that, don't try to submit your proposal on the 30th itself. There is a heavy load on the server on that day. So even the ICMR suggests that you submit it 1 or 2 days before, because sometimes they don't allow extension. So in that case, your proposal might not get submitted, and we really don't want that. So try to submit it before and only.
Okay, thank you guys. Thank you so much.
Let me add on this also. Yeah, one thing is like very important before you submit your ICMR proposal is also getting the institution ethics committee letter. Usually, I think in different colleges it definitely takes a while. So it's always better to get everything ready a week prior to the deadline, just in case.
Okay. Someone has asked a common doubt. What is the duration of ICMR STS series, I guess? Yes, and yeah, the timeline of the research and what has to be done before uploading the ICMR and after. Okay, anyone wants to take this question? Timeline of the ICMR research project.
Okay, so can I take that question?
Yes, Shravan, please.
Okay. So basically, it is expected, it is divided into like total it is 6 months, but it's divided into 2 months, 2 months, 2 months into 3 parts. So basically, in the year that you apply, it is expected that you develop the concept note. Okay. So this phase they consider the 2 months from that part. Okay. Next year, it is expected from you that you do the data collection part. Okay. If your study gets selected, then you have to do the data collection part, preferably like according to them officially in these like summer vacations, whatever it is, in the that 2 months part you have to do the data collection, and then you have to make an interim report from the data collection, and then you have to submit that report. And then after that, in the year after that, you have to submit your final report to the ICMR. So it is like extended over like 3 years, but actual duration is just 6 months for it. And the 2 months, if from that also they have been like, they are these 2 months that you are applying. Like making the concept note and applying for it. So basically, yeah, after this, 4 months are there, 2 months next year and 2 months after that. So I hope.
Wonderful.
Yes,
Yeah. Wonderful, wonderful. Thank you so much, Shravan. Guys, we are running out of time, so we'll wind up till now. All your questions have been noted, so every question will be answered in the ICMR group. So if anyone doesn't have the WhatsApp link, we have also shared the WhatsApp link in the chat box. You can join the WhatsApp. Yeah. Over to Akash sir. Akash sir.
Yeah. Am I audible, Mano?
Yes, sir. Yes.
Yeah, I'd like to have a vote of thanks. Respected dignitaries, esteemed speakers, seniors, and dear friends, as we come to end of today's session, it is my privilege to deliver the vote of thanks. First and foremost, on behalf of IMA-MSN Tamil Nadu State Branch, I extend our heartfelt gratitude to our speakers for taking the time to share your knowledge, experiences, and practical insights with us today. As a fellow medical student and young researchers, hearing your journeys, challenges, and tips has made researchers feel much more approachable and achievable for all of us. Today's session truly reflects the spirit of students, learning from students, from selecting the right research question to understanding methodology and proposal writing. Every discussion gave us clarity, motivation, and confidence to our own very first steps into research and opportunities like ICMR STS program. I would like to sincerely thank the respected patrons and state leadership of IMA Tamil Nadu State branch for their constant encouragement and support towards student academic initiatives. A special note of gratitude to Dr. Arunagiri sir, Dr. Ajay Karthik sir, Dr. Bala Hariharan sir, Dr. Hariram sir for your continuous guidance, motivation, and support throughout the planning of this event. My heartfelt appreciation also goes to the organizing team, Manoranjani, Akash, for the teamwork, coordination, and efforts behind the smooth conduct of the today's program. Finally, a sincere thank you to all the participants who joined us today, interacted actively, and made this session engaging and meaningful. Your enthusiasm to learn and explore research is what makes program like this truly successful. With gratitude and appreciation, we conclude today's session. Thank you, everyone.
Thank you, everyone. You were an amazing audience.
Yes. Thank you so much, guys. Thank you.
Thank you
you
to all the
all.
Thank
speakers.
you,
Thank
guys.
you, Manu.
Yes.
If you have any doubt, just post in the WhatsApp group. We will be there in the group to clear it out. Okay.
Yeah. Yes.
Thank you, guys.
Thank you, Manu. Thank you, Akash. Thank you, Akash, bro, for giving us this
Yeah,
opportunity.
thank you, everyone. Thank you.
Yeah,
Thank you
thank
to
you.
IMA and RIT subcommittee for
Thank you,
organizing this
everyone.
panel discussion.
You. Thank you. Thank you, guys. Okay, we can audience. You can leave the meet. Yes. Speakers also. Yeah. Thank you so much for
Thank
joining.